Hello, everyone. It's Wendy here at IDC World Source. Thank you for joining us today for our Heart Health Series Part 2. So we have Lindsay Beal again to do the presentation, and we thank Lindsay very much for taking the time out today to do the presentation. I don't know how many of you so far that are on the line attended Part 1, but I found it very interesting, and hopefully you did too. And hopefully you will find Part 2 just as interesting and informative. So thank you very much, Lindsay, for doing the presentation today, and we're just going to get you to take it away.
Thank you so much, Wendy. Hello, everybody. For anybody that doesn't know me, I am Lindsay Beal, and I am the Insurance Relationship Manager for Dynacare out in BC. So if anybody ever has any questions, feel free to utilize me. If you're in different provinces, I can always as well point you in the right direction to your insurance relationship manager as well. So what Wendy was mentioning, how we're going to go over part 2 of our Heart Health CE series, which will be going over things like arrhythmias, cardiomyopathy, valvular disease, all of that. So let's get started. And then as well, for anybody that has any questions, I encourage you to type them up in the chat function. That way, we're going to do a Q&A at the end. So that way you don't forget your question, and then we can go through them as we go along. All right, so let's get started. So first, we're going to touch on heart disease. So what is heart disease? It is a cardiovascular disease, also known as heart disease, which is a term used to encompass a group of conditions and diseases that affect the function and structure of the heart. So things that would include heart disease are CAD, which is coronary artery disease, heart failure, cardiomyopathy, arrhythmias. All of those encompass what heart disease can entail. As well, many problems with the heart can be attributed to something called atherosclerosis. Okay, now what this is a condition that develops when a substance called plaque builds up in the walls and obstructs the flow of blood into the coronary arteries. Okay, so I'm sure many people are familiar or have heard terms like this before, where there's a plaque buildup in those arteries, which is very dangerous. It obstructs the blood flow to all different parts of the body and the organs, as well as the flow to the heart. So it can be a very, very serious thing. So that's why it's so important to make sure that your heart health is good, and that we're eating well, we're exercising, and making sure that we're having those appropriate doctor follow-ups, as well as making sure that you're also being very aware of your family history and things like that. Okay, so now let's just touch quickly on heart disease prevalence. Okay, so worldwide, and this is according to the World Health Organization, cardiovascular disease is actually the #1 killer in the world. Okay, and that is across the board. Now there is more than close to actually 18 million people that die annually from cardiovascular disease. So another abbreviation for that is CVD, and it's a very staggering number, and it's a huge concern across the world. Now in Canada, if we're going to look specifically here, heart disease affects about 1.3 million Canadians, okay? And about 2.4 million Canadians aged 20 years or older live with some type of heart disease, okay? So that's as well a very staggering statistic. Now, heart disease is also the second leading cause of death in Canada, claiming more than about close to 50,000 lives in 2012. 9 in 10 Canadians over the age of 20 have at least one risk factor for heart disease, and 4 in 10 have 3 or more risk factors. Okay, so this is always something that needs to be attributed to focusing on and making sure that we're all keeping healthy and safe. So now let's touch on an overview of the heart. Now in the part 1 session, I'm sure this will look quite familiar as I touched on it previously, but just to give you a quick overview again, this is what a normal heart, healthy heart would look like, okay? So a bit larger than the fist, and it pumps blood continuously through the circulatory system, okay? And depending on your body is how the heart pumps the blood and delivers oxygen, as well as nutrient-rich blood to the body cells. So this is what makes us be able to breathe, be able to function, move, all of that. And when the cells are nourished properly, the body can function normally. Now, if the cells aren't nourished properly, then we're going to run into issues, right? So this is where heart disease comes into play, and you know, different ailments and diseases and issues with the body come to play, okay? Now, the structure of the heart is divided into 2 sides, okay? So there's the left and the right. And the left and the right side each are divided into 2 parts. So there's an atria and ventricles, okay? So there would be 2 atrias and 2 ventricles on each side, as well as 4 chambers as well. And this is how the heart acts to squeeze or contract and pump that blood. And as well, these pumping motions, as I was saying, contractions, are triggered by a small electrical pulse, which is located near the top of your heart and comes from the sinus node, okay? So think of the sinus node as the brain, all right? And the electrical pulse makes the 2 small upper chambers, which are the atrias. So just keep in mind, atrias are at the top, ventricles are at the bottom. And what happens is they contract, pushing blood through those valves into the 2 lower main pumping chambers, which are the ventricles. Now, the electrical pulse reaches the ventricles, which contract, pushing the blood out of your heart to your lungs and to the body, okay? So now let's just touch on how a healthy heart works, okay? So first off, the blood returning from your body through veins enters the right side of the heart into the right atria, and this blood is low in oxygen, okay? And this blood travels through the tricuspid valve into the right ventricle, and then after that, your heart pumps that blood into the lungs, which carbon dioxide is removed and oxygen is added. Okay, so as we know, the blood that was returning from the body was low in oxygen, and now as it's gone through the heart and through those valves, it's now getting pumped full of oxygen and then flowing back through the body. So the oxygen-rich blood travels back to your heart, entering the left side now. And then this blood travels through the mitral valve to the left ventricle. And then finally, the left ventricle pumps this oxygen-rich blood through the aortic valve into the aorta, which pumps it out to the rest of the body again. So it's just constantly flowing through and providing that oxygen-rich nutrient blood back into the system. All right, so now let's touch on some conditions. Okay, and the first one I want to touch on is arrhythmia. I'm sure many of you have heard what this is, but it simply is an abnormal heart rhythm. Okay, and an arrhythmia can be something that isn't serious, or it could be something that has an underlying condition. Okay, so I'm sure many of you have experienced maybe if you get stressed out, or sometimes you feel like your heart skips a beat or something like that, that sometimes that can just be absolutely nothing and it's normal. Other times, if it's a regular occurrence, it could be something that is more serious and underlying. Okay, so let's just talk quickly about a normal arrhythmia. Okay, so with each heartbeat, an electrical signal spreads from the top of the heart muscle to the bottom. And as the signal travels, it causes the heart to contract and pump that blood. Okay, now each electrical signal begins in a group of cells called the sinus node, which I mentioned is sort of like the brain of the heart. And this is located in the heart's upper right chamber, the right atrium. Okay, and the signal goes down to the ventricles, causing them to contract and pump blood to the lungs and the rest of the body. The ventricles then relax and the heartbeat process starts all over again. Okay. So let's touch on a little more of what arrhythmia is. So it's a problem with any part of the process that can cause an arrhythmia, and it's caused when the heart's natural pacemaker. So I'm sure many of you have heard before, sometimes people have to have a pacemaker put in their heart to control their heart rhythm. This is because they have a severe type of arrhythmia, okay? Now, we all are built with our own natural pacemaker, and this is located in the sinus node, but what happens is sometimes it may not work, and that's where we run into issues. So a normal heart rate for somebody is between 60 to 80 times per minute, okay? And that's usually at a resting state, okay? In a healthy adult, the SA nodes send an electrical signal to begin a new heartbeat 60 to 100 times a minute. Now, each person has their own rhythm, okay? So not everybody's is exactly the same. They can all have their own slight imbalances. So if your heart beats too slow or too fast, it can affect how well your heart is working and how that nutrient-rich blood is being pumped around your body and nourishing those cells, okay? And those organs and everything, tissues, you name it. So a treatment for arrhythmia is things like changing your lifestyle. So an arrhythmia can be caused by poor nutrition, lack of exercise, things like that. So changing your lifestyle, stress as well. So treatments could be medication, even surgery or non-surgical methods, as well as some prescribed medications can also stabilize somebody with a severe arrhythmia. Okay. Okay, and there are different types of arrhythmia. So it's not just standard across the board that arrhythmia is just one component. There are different types of arrhythmia. One being bradycardia. Okay, so this is when the heart beats less than 60 beats per minute. So as I mentioned previously, a normal healthy adult ranges from a healthy resting heart rate anywhere between usually 60 to 80 beats per minute up to 100. So what can happen, as you can imagine, if your heart is beating quite slowly, lower than that 60 beats per minute, you're not getting all of those nutrients as quickly as you should, okay? So it can cause things like fatigue, dizziness, fainting, and a pacemaker can correct this, okay? And it can be caused by the following reasons. So the sinus node is too slow, or some medications could actually be affecting your arrhythmia, okay? So they could be slowing down, you know, the beats per minute, which is not good. So this can also be called a heart block, so a slowing down or interruption of the electrical signal to the ventricles of the heart. Okay, so some of the causes of this would be problems with the sinus node, as we mentioned, as well as problems in the conduction pathways of the heart, a metabolic problem such as hypothyroidism, people who have low thyroid hormone. So what happens there is this can cause some damage from heart attack or heart disease. And that's why it's so important to understand and be very conscientious of your health and be tested frequently, because you know, thyroid issues can cause other issues. So, for example, if somebody is pregnant, pregnancy can actually affect your thyroid after the fact, okay? So some women experience thyroid issues after, and that can pose, you know, a threat in the future, and then cause more serious conditions. So always, always, always making sure that you're staying on top of your health, getting those regular checkups, and seeing your doctor when needed. Okay, so let's talk a little bit more of the types of bradycardia. Okay, so the first one that I'm going to discuss is the first degree heart block. So this is where the electrical impulses are slowed as they pass through that conduction system. It rarely causes symptoms and no treatment is generally needed. Okay. Now, if we get into the second degree heart block, this is where the electrical impulses are delayed further and further with each heartbeat until the beat fails to reach to the ventricles entirely. Now, this is something that is much more serious than the first degree. And as well, it could, when you're looking at this, you may think first degree is the worst. It's actually backwards, okay? So we're going from least concerning to most. And then there's second degree heart block type 2, where some of the electrical impulses are unable to reach the ventricles, which is very, very serious. And this is when somebody may need to have a pacemaker put into their heart, okay? And then the third degree heart block is the complete heart block. So none of the electrical impulses from the atria reach the ventricles, and then the low chambers generate their own heartbeats, okay? And then there's also a bundle branch block where the electrical impulses are slowed or blocked as they travel through the specialized conducting tissue in one of the two ventricles, okay? Definitely a concern, but if it is a first degree, sometimes people they don't even know that it's something that's going on and no treatment is usually needed, okay? And then as we get into second and third, that's where it becomes more and more serious. Okay, so some symptoms here are that it can cause an insufficient blood flow to the brain with symptoms like fatigue or feeling tired, feeling weak, dizziness, confusion. You could even faint or feel like you're almost going to faint. As well, be short of breath, feel like it's hard to exercise. And then in some extreme cases, cardiac arrest could occur. Now, if this is not treated, what could happen is somebody could experience heart failure, fainting, injury, angina, hypotension, which is low blood pressure, which we talked about last time, and hypertension, which is high blood pressure. Okay, so those are some of the severe issues that could come along if not treated. Okay. All right, now let's take a look at some underwriting considerations. So if your client has experienced bradycardia previously, or if they're dealing with it currently, this is what the underwriter is going to look at. So they're going to look at some considerations here. So is the heart rate below 50 beats per minute? Are we looking at a first or second or third degree, or a bundle branch block as we discussed in the previous slide? And then the requirements are that are going to be involved. Okay, so an ECG, as we know, this just checks the heart and that the electrodes are firing properly, okay? So that would be a requirement if your client is experiencing or going through bradycardia through the insurance application. Now, something that's also called a Holter is something where you would walk around with it and it would just measure your heart rate and all of that firing. So very similar to an ECG, but it's something that you would wear around instead of going somewhere, okay? with the heart rate being below 50, if everything is okay with the ECG, then it's usually going to be a normal rating, as long as that ECG is normal after. Okay. Now, if we get into things like the first degree heart block, where it's a little more serious, then an APS would also be needed. Okay. Now, this is usually a 0 to a rating. Okay, so it just depends on other factors as well. So if the client is only experiencing bradycardia, nothing else is going on, then there is potential that the rating could be quite low or a little bit higher. It just depends on the severity. Now, if we get into a second degree heart block, this is where an APS and ECG would be required. Now, with regards to the decision, now, if this has not been investigated, it will warrant a decline decision. So if somebody isn't taking care of this, now, if investigated and the condition is stable and there is no coronary artery disease, then what would happen is there would be a high substandard rating or a decline, okay? And then if we get into third degree, so if somebody has a pacemaker, we're going to be looking at other things like heart conditions, age, the stability of that bradycardia. Then what would happen is if somebody has no pacemaker, then a high rating to a decline. Now, if somebody has a pacemaker in, then, and it's been in for less than 6 months, it will be a straight decline. And if they have a pacemaker in under the age of 30, it would be decline as well, okay? Now, in some situations, an underwriter may decide that it would be a very high rating, okay? And then with the bundle branch block, same requirements as the previous, but usually there's no rating if there is no cardiac history, okay? Now, if there is as well no rating there with any cardiac history, if there is things that are involved like chest pain, hypertension, or coronary artery disease again, then this would be a decline, okay? All right, so a few other types of arrhythmia. So we have tachycardia. So when we say tachy, this means fast, okay? So previously we were talking about things being too slow, the beats per minute going below 60. So tachycardia is when the heartbeat is beating way too fast, okay? So when it is over 100 beats per minute at a resting state, okay? So this puts a lot of strain on the heart and the vessels, the aorta, the arteries, all of that, if the heart is beating too quickly. There are two main types. So tachycardia above a ventricle and tachycardia in the ventricle, okay? So above the ventricle is where the heart beats rapidly in the atria, so the top chambers of your heart, or in the AV, the atrial ventricular node, which is the electrical connection between the atria, so upper chambers, and the ventricles, as we know, are the lower chambers, okay? Now, there are things called atrial flutters. So for example, somebody could feel their heart rate is normal, but they just get an occasional flutter here and there, okay? And this is an extra or early electrical impulse that travels around the atria in a circular, predictable pattern, moving in an organized circular motion rather than down its normal path, okay? And this causes the atria to contract at a higher rate and beat faster than the ventricles. And people with AFL usually continue to have a steady heartbeat, even though it is faster. Okay, I experienced something similar to this when I was pregnant with my second child, and I was in my first trimester. Now, my hormones are the strongest in the first trimester because they're working so hard at, your body's working so hard at, developing that baby, right? And so it's your hormones are just very heavy at that time, and it actually affected my heart a little bit, and I experienced some like heart flutters as well as a fast heartbeat here and there for a couple weeks, and then it went away after that. But it was definitely something that I was very concerned about, but it's something I went to the doctor and they said that it's something that's normal, and hormones can cause that. So these types of things can happen, and it's just so important that if something does come up that isn't normal for you, it's best to just get that checked out. Now, another thing that can cause this is medications as well. Okay, so sometimes medications can cause, weird different heartbeats or flutters or things like that. So making sure that you're paying attention to that as well. So some symptoms can include heart palpitations, so feeling like it's an irregular heartbeat, fast, steady pulse, shortness of breath, trouble with everyday exercises, or pain and pressure, tightness, or discomfort in your chest. Okay, you can also experience things like dizziness, lightheadedness, or fainting as well. So some of the complications with an atrial flutter are usually non-life-threatening, okay? But if they are left untreated, then the side effects can be potentially life-threatening, okay? So AFL is another short version of this. So this makes it harder for the heart to pump blood effectively. So it increases the likelihood of somebody developing a clot. And what can happen is a clot could travel to the brain and lead to a stroke or a heart attack. So for those of you that attended my previous session, I was talking about my sister who had and is still dealing with a pulmonary embolism. So this is where she, a clot actually was in her lung, okay? So it damaged her lung, and she had to have surgery to open up that pulmonary artery that's connected to her lung, because her lung was damaged from not getting that appropriate blood flow, okay? So clots are very concerning. This is why, again, always go get checked out if you have anything odd or unfamiliar happening. So without treatment, AFL can cause a fast pulse rate for long periods of time. So it's almost like you're stuck in the wrong heart rate, okay? And then when the ventricles beat too fast for long periods of time, this weakens those heart muscles, okay? And it's so important for those heart muscles to stay nice and strong. And this condition is called cardiomyopathy. And this can lead to heart failure. And so without treatment, it can also cause an atrial fibrillation, okay? Short term of that is AFib, all right? Oh, I just went too far here. Okay, so now let's just talk about the ventricle here and atrial fibrillation. So the most common types of arrhythmia affecting approximately 350,000 Canadians, according to Heart and Stroke. So cardiac arrhythmia, okay? So this is something that can increase with age, and also with other risk factors such as diabetes. So as we know, diabetes is when your blood glucose levels are too high. And what this can do is this can affect all of those important vessels and weaken those walls with too much blood glucose in, too much glucose in those veins. It can also contribute to high blood pressure as well as underlying heart disease. So now when a person has AFib, the normal beating in the two atria is irregular, okay? And then the blood doesn't flow as well as it should form the atria to the ventricles. And then the electrical activity in the atria does not follow its normal path and is very rapid. Okay, and then this can stimulate the atria randomly and at high speed. So as you can imagine, this could cause more issues. So things like rapid contractions, and then the heart not being able to pump effectively. And this could be something that happens on an occasion, or it could end up becoming a permanent condition. Okay. So some of the types here. So there is 3 different types. So there is the perioxysmal, and this is an episode that occurs occasionally, but then it can also just stop spontaneously. And it can last for a few seconds or can even last for multiple days before it stops and returns to normal. And it can progress to persistent or chronic. So the second type is persistent. So very similar to how the name sounds. So this is more persistent. It lasts longer than 7 days, and you have to have treatment to make it stop. And then a normal rhythm may be achieved with medication or electric shock treatment. That sounds a little scary, but it is actually quite effective. And then chronic, this would mean that this is a permanent effect. Okay, so it's going to be ongoing for many, many years, if not your whole life, and it cannot be changed back to a normal rhythm. There's no treatment that can make it go back to normal. Okay. All right, and so some of the complications could be that somebody is at a much higher rate of a stroke, okay, if they are dealing with atrial fibrillation. The risk factors are by 4 to 5 times, and strokes caused by complications of AFib, they actually tend to be more severe than strokes with other underlying conditions. So that's a big risk factor there. As well as it causes about 15 to 20% of strokes when they occur when blood flow to the brain is blocked by a clot, okay? Or by fatty deposits called plaque, as we were talking about previously, in the blood vessel lining. So important for those arteries and veins to stay nice and clear. And some symptoms that somebody may feel is that this may cause lightheadedness or palpitations. If it goes on for several days or longer, it may increase your risk of stroke. And this is because the blood is trapped in the atria, okay? And then this can produce a clot and travel from your heart to your brain, which then means stroke, okay? So there are some risk factors here for AFib. So the older you get, the more susceptible you are to this. High blood pressure is a huge risk factor for AFib. Obesity can play a factor. European ancestry. Diabetes is a big one. Heart failure, heart disease, hypothyroidism, which I had mentioned previously, chronic kidney disease, heavy alcohol use. So alcoholics are at a huge risk factor, as well as enlargement of the chambers of the left side of the heart. Okay. So if an underwriter is looking at your client who has some type of atrial fibrillation, they're going to look at things like their current age, the date of diagnosis, and as well the age at onset, how frequent, as well as any sort of complications. So have they had any complications, or has it stayed relatively neutral? Any concurrent impairment. So things like, as I was mentioning in the previous slide, alcohol abuse, valvular disease is a big one as well. And then their current symptoms. So what are they experiencing right now at this moment? Okay, is it nothing? Are they experiencing things like that they're feeling fatigued or they're having chest pains, anything like that. And then types of investigations and treatment. So what has the doctor looked into? Are there any treatments that they've had to go through to help with this? Any chronic or paroxysmals, anything like that, and any coexisting conditions as well. And then in addition to that, they're going to want to look at the family history as well for any sort of cardio vascular diseases, anything like that, stroke, valvular diseases, and then modifications to lifestyle. So have they changed certain habits? So say, for example, are they healthy otherwise? How is their lifestyle? Are they exercising regularly? Are they maintaining a healthy weight? All of that. If we look at the requirements here, it will automatically be an APS as well as an ECG. And the decision will be as follows. So the ratings and applications approval are dependent on the age, the severity of the disease, and the frequency of attacks. Okay, the underwriter is going to look at if the condition was found recently. And if it was found recently, then they will postpone the application and ask you to resubmit it at a later time, or they will decline it until the AFib has been fully investigated. And in addition to that, any other underlying health disorders, any ratings according to cause, if there has been new diagnosis on insurance exams, this would result in an automatic decline, as well as controlled paroxysmal AFib with minimal attacks, and as well ventricle rates greater than 90 warrant a decline decision, as well as ratings with vary to age and time lapse since the last episode. In addition to that, use of long-term anticoagulation is favorable. Okay, so lots of tongue twisters there. Okay, and so now we're going to talk about ventricular tachycardia. Okay, so what can happen is the ventricle tachycardia will occur when the ventricles beat too fast. So this is a big issue because what happens is when it's too fast, but it's a regular rhythm, it can cause more strain, okay? So this could be serious because the ventricles are responsible for pumping blood to the rest of the body. So if it becomes so severe that the ventricles can't pump effectively, it may be life-threatening. So if the heart is pumping too fast, it's not going to be able to get that flow properly to reach all parts of the body. And then as well, it just puts added stress on the heart as well. So this can be treated with medications, as well as things like non-surgical procedures to destroy the malfunctioning cells, or surgery to remove the damaged heart tissue. So all of that can play a big part in ventricular tachycardia. So most cases is caused by heart disease. So for example, somebody who had a previous heart attack or have a congenital heart defect as well, that can also play a big role, right? This is also the leading cause of a sudden cardiac death. Okay, so if somebody just randomly out of nowhere has a heart attack, it could be because ventricular tachycardia. Okay. Okay, so some causations of this are non-prescription decongestants. Okay, so some over-the-counter drugs to decongest, and some herbal remedies as well. This can also cause things like ventricular tachycardia, which, you would think herbal medications are fine, but sometimes they can actually cause some serious issues depending on the person. So things like ma huang or ephedra, these are all herbal remedies that have been known to cause this. Okay, diet pills are a big one as well as pet pills that often contain stimulants. So these can trigger episodes of ventricular tachycardia as well. And then illegal drugs. So things like stimulants, so cocaine, for example, this can cause this as well. And some of the symptoms that somebody would experience are those heart palpitations where your heart is beating irregularly or feels like it's skipping a beat, dizziness or lightheadedness, shortness of breath, pain in the chest area or pressure, feeling of fainting or a weak pulse or no pulse. Okay. Okay, so some underwriting considerations here. Some considerations that the underwriter will look at are as follows. So they're going to look at things like, was any sort of heart disease factoring in here, Wolff-Parkinson, White syndrome, valve disease, cardioversion, reoccurrence of episodes, anything like that that would involve that type of treatment, as well as heart rate, so faster than 200 beats per minute. Now, I have a friend that was in her mid-20s, and she had this exact issue. All of a sudden, her heart would suddenly be beating over 200 beats per minute. And what she had to do is she had to have that surgery where they go through basically your leg up into your heart, and they use electrical impulses to fix the issue. Okay, so she's had no problem since, but I remember being with her, and suddenly she was saying, I'm not okay, I need to go to emergency, and her heart was just over 200 beats per minute. But that electrical pulse just sort of reset her heart, and now she's completely fine. So just one of those things where sometimes the heart just gets out of balance, and then it needs to basically just be snapped back into reality. So as well, some considerations as well would be, is there a time since onset, as well as associated heart disease, frequency and date from last occurrence. So all of these are usually going to be a decline. However, in some cases, there could be a rating, as well as, the underwriter is just really going to need to know if any other factors are involved, such as any type of heart disease, hereditary factors, all of that. Okay. And then, of course, drug use is a big one. All right. Okay, so now let's take a look at the types. So what can happen is incorrectly timed electrical signals, or ones that do not follow normal pathways, may trigger ventricle fibrillation. Okay, so like in the atrial fibrillation, what happens is the electrical signal splits and goes off on a random path around the ventricle, and instead of following its normal route. Okay. So this results in a series of rapid and ineffective contractions of the ventricle. And if this is not treated, it will most likely be fatal. Now, if it is treated by an electrical shock to the heart, this shock enables the heart to return to its normal rhythm, as I was mentioning with my friend, and is the most serious cardiac rhythm disturbance. Okay, so the lower chamber quivers, and the heart can't pump any blood, and it causes a cardiac arrest. Okay. Now, some causes could be lack of proper blood flow to the heart muscle, or damage to the heart muscle from a heart attack, cardiomyopathy, as we discussed previously, or any problems with the aorta, or drug toxicity. Okay. So these things can involve, such as somebody who is addicted to drugs, somebody who's using too much or they have overdosed can go into ventricular fibrillation and then have a heart attack. Okay. All right. So with this, all cases are decline. Okay. All right. And now lastly, let's touch on cardiomyopathy. I know we've mentioned it a few times throughout the presentation, but let's just really get into some more details here. So this refers to a heart muscle disease. Okay, so cardiomyopathy affects the muscles and it can lead to an arrhythmia or cardiac arrest. So it can lead into the same things that we have talked about as well. So some risk factors are family history is a big one, high blood pressure, some conditions and diseases that affect the heart. So things like CAD, if somebody's had a heart attack before, as well as alcoholism, obesity, drug use is a big one. Cancer treatments can also cause this, diabetes, thyroid disorders, and so on and so forth. There's many, many different factors. Now, with cardiomyopathy, there's a couple different types. Okay, so we have a dilated cardiomyopathy, and this is the most common type. So this occurs mostly in adults between the years of 20 to 60, and it affects the heart's ventricles and atria. Now, this starts in the left ventricle, and the heart muscles begin to dilate. And this stretches and becomes thinner, which obviously is not good. And then the inside of the chamber enlarges, and the problem often spreads to the right ventricle and then to the atria. So as the heart chambers dilate, the heart muscle doesn't contract normally and cannot pump blood very well. And then the heart becomes weaker, and that's when heart failure can occur, okay? So some of the causes are 1 in 3 inherent: alcohol, coronary heart disease, heart attack, high blood pressure, diabetes, thyroid disease, viral hepatitis, and HIV, and certain infections and toxins can also cause this as well. Okay. Now I know this is a lot of information, so if anybody has questions later on or they'd like me to look into something after, please let me know. I know this is quite a bit of information. So now if we look into hypertrophic cardiomyopathy, this is where the heart muscles become abnormally thick, okay? And then the thickened heart muscles can make it harder for the heart to pump blood. And then this actually goes undiagnosed quite frequently because there are no symptoms, okay? And then in a number of people, it can also cause shortness of breath. So these are some of the symptoms if somebody isn't asymptomatic, and things like chest pains, as well as problems in the heart electrical system, resulting in arrhythmias. So some complications could occur, okay? So arrhythmias, heart failure, cardiac arrest, obstructive blood flow, all of that, which is very serious. And then there is restrictive as well. So this is a rare form of heart muscle disease that is characterized by restrictive filling of the ventricles, okay? So the squeeze of the heart and wall thicknesses are usually normal, but then the relaxation of the filling phase of the heart is very abnormal. So what this does is this causes the heart muscle to become stiff, and then it doesn't allow the ventricle chambers to fill with blood normally to go and distribute that healthy oxygenated blood throughout the body. So this inability to relax and fill with blood results in a backup of blood into the atria, which is the top chamber of the heart, and the lungs and the body, causing the symptom and signs of heart failure, okay? The most common symptom is heart failure, and some of the causes can be diseases of the heart lining, or fibrosis, or there is rare syndromes called Loeffler as well. So these can all be some causes of cardiomyopathy. Okay. And some underwriting considerations here. If somebody is dealing with a dilated and all tests are normal and fully recovered, then and they have no family history of sudden death, and diagnosis within 1 year would be a decline. Thereafter, the rating to 0, or currently present, stable for less than 2 years is a decline. Thereafter would be a high substandard rating. Okay, now if we are dealing with a hypertrophic, then anybody that's younger than 25 would be a straight up decline. Age 25 to 65 would be a very high substandard rating. Over 65, they would look at an individual consideration based on, you know, if there was any other conditions that were posing a threat, all of that. And then for severe, all ages would be a decline. And then restrictive is a straight out decline. There's no factors there, it's just a decline. Okay. Okay, now we're just going to talk about valvular disease, and then we will wrap it up. So this is where there is damage to or a defect in one of the 4 heart valves, okay? And what can happen is the Ventricle and the tricuspid valves control the one-way flow of the blood between the atria and the ventricles. And then closing of these valves account for the sounds of the heart heard through the stethoscope, okay? And then the pulmonary valve controls the flow of blood from the heart to the lungs. And the aortic valve controls blood flow between the heart and the aorta, okay? So let's talk about what is it exactly. So your heart valves lie at the exit of each of your 4 heart chambers and maintain one-way blood flow through your heart. In addition to that, the blood flows from your right and left atria into your ventricles through the open tricuspid and mitral valves. And when the ventricles are full, the valves close, okay? And as the ventricles begin to contract, the pulmonic and aortic valves are forced open and blood is pumped out of the ventricles. Now, when the ventricles finish contracting and begin to relax, the aortic and pulmonic valves shut, and these valves prevent blood from flowing back into the ventricles. And this pattern is repeated over and over, okay? So these valves are the ones that are most frequently affected by valvular heart disease, okay? So that's a key point there. And then the normal functioning valves ensure that blood flows into the correct direction at the correct time. Okay, so some types are valvular stenosis, okay? We also have valvular insufficiency and mitral valve prolapse, okay? So some key takeaways here are with stenosis, this is where the heart valves don't open as much. And to compensate, the heart muscle enlarges and thickens. And then in some cases, there is blood pooling in the chambers, which could definitely cause a clot and then increase risk of stroke or pulmonary embolism, which is what my sister had. And then all 4 valves can develop stenosis as well. Now with insufficiency, this is also called regurgitation, and this is when the valves don't close as they should, and this allows blood to leak backwards, okay? And then prolapse is when the valve leaflets bulge or flop back into the left atria. So what happens there is they may not close properly, and then that blood can flow backward through it, okay? This can cause tissues of the valve to become abnormal and stretchy, and as well cause the valve to leak. But this condition rarely causes symptoms and usually actually doesn't require any treatment, And then there is a few more here. So we've got congenital valve disease. We've got bicuspid orbit valve disease and acquired valve disease as well. Okay. So congenital, this form of valve disease most often affects the aortic or pulmonic valve, and these valves may be the wrong size, have that malformed leaflet, as I mentioned, or that may not attach properly. Okay, and the next, this affects the aortic valve, and instead of the normal 3 leaflets, this causes the bicuspid or aortic valve only to have 2. So as a result, the valve may not be able to open or close properly, or it could leak as well. And then acquired is a problem that develops with the valves that were once normal. And this may involve changes in the structure or the valve due to the variety of diseases or infections, okay, such as rheumatic fever or endocardia. Okay. All right, so some of the causes of this could be CAD, heart attack, cardiomyopathy, syphilis, high blood pressure, aortic aneurysms, connective tissue disease, as well as some of the less common ones would be tumors, some types of drugs and radiation. Okay. And then in some severity of symptoms, this does not always correlate with severity of the disease. So what can happen is some people may have a mild heart valve disease but have severe symptoms. Advanced cases of the disease can lead to congestive heart failure, as well as many of the symptoms are similar to those associated with congestive heart failure. Okay, so some of these other symptoms can include palpitations, chest pains, feeling very tired, dizziness, fever, and then a sudden rapid and weight gain. Okay. And then lastly here, this is going to be our last slide. These are the underwriting considerations for valvular disease. Now, if it's stenosis, then the consideration is going to be the same as the other issues. So age, cause, duration, all of that. If there are any additional factors such as AFib, coronary artery disease, hypertension, there's a pacemaker, all of that. And a requirement will be APS as well as an echocardiogram and an ECG. Okay, so the decision would be if somebody is under 25, there will be an individual consideration with or without surgery. No surgery rating related to age from mild to moderate degree to severe decline, or with surgery less than 1 year, a decline, and then valve replacement and other surgery, high substandard rating, and in the presence of additional factors, usually a decline. Okay, so I'm going to leave that here. I think I did see in the chat pop up somebody asking for the slides. I will absolutely send a copy to Wendy for all the PDF copies of this. I know that it was a ton of information. It's very heavy and not that uplifting, but it is something that is good to know if you do run into a client with any of these heart diseases. And as I had mentioned, it is the #1 worldwide factor of death and the leading cause. So it's something that happens oftenly. It is second in Canada, so we do need to be aware of this, especially if you have a client going through underwriting, trying to get insurance. So does anybody have any questions before we end? I might just go and take a peek in the chat here.
Yeah, there was only a comment from Taryn Shudlack just saying, wow, endless scary stuff.
Yes.
It's true. It's very true, Taryn. And then
It
somebody
is.
asked for the, yeah, and then there was just the question about the slide deck and the presentation. So we will have, I did post something in the chat to say the slide presentation, once I get that from Lindsay, I'll post it in the IDC Win Big website. We always put it under we have a help article in there called 2021 recordings and video links. So it'll be there as well as the link to the recording also.
And our next presentation that I host, I'll make sure it's much more uplifting. Maybe we'll talk about marijuana or something fun.
That's funny. Okay, well, if there are any additional questions, you can certainly reach out in the IDC Win Big live chat, and we can always send them off to Lindsay if there's any other questions. But if not, thank you very much, Lindsay, for the presentation today. It was very informative. You're right, lots of information. And probably relatable for a lot of people. You probably know someone, maybe it's yourself, maybe a family member or friend like you, the examples you gave too, Lindsay. So again, thank you for your time, and I hope everyone has a great rest of the day and upcoming long weekend.
Thank you.
Okay, take
Bye,
care,
everybody.
everyone.